Well, tonight, continuing our coverage of long COVID patients who are suffering in silence. Last night, we introduced you to two women in our area who were forced to use wheelchairs just to get around in their own homes because of just debilitating fatigue. They told KCRA 3 Investigates that trying to get medical care has been a struggle.
I would reach out to my doctors every couple of days, and they would just tell me there's nothing we can do for you. We had to find a long COVID clinic in Stanford. We got a referral to go there, and the wait was 8 months.
Wow. You can hear you can't even get a breath in, right? Well, there are just two of many patients right here in our area trying to get some answers and treatment for long COVID.
KCRA 3 Investigates reached out to Northern California health systems to see how they're handling these long COVID cases and why it's often such a long wait to get care. KCRA 3's Brittany Johnson has our report.
Yeah, that's the funny thing, is that I look fine in the pictures, and you post them online and everyone thinks you're better, but I had to be carried to this site. My husband carried me.
For patients with long COVID, it can feel like they're suffering in silence.
And I was so weak that I had trouble standing.
With no treatment and relatively little research, even doctors are growing frustrated.
If you think of like most diseases we learn about them over years and decades, and we just don't have that time frame here for these patients, unfortunately.
We're still learning more about who's most likely to have long-term symptoms.
Some patients had really, really severe COVID and had recovered just fine and don't have any long-term symptoms. You got some people that stayed at home, they had a little fever, they didn't feel very good, and then they're completely debilitated for months. And it just something just doesn't match up.
The CDC says people with the highest chance are those with severe COVID cases or underlying health conditions. But it's not limited to those cases. Before getting sick, both Chelsea Brown and Jamie Rodriguez were marathon runners with no known pre-existing conditions.
I was a runner before, and I had just run a marathon the month before, so I was in the best shape of my life.
Rodriguez said within months, she went from the best shape of her life to thinking her life could be over.
I told my husband something's wrong. I couldn't lift my foot from the floor to help myself to the bathroom, and I remember him driving me to the hospital, and I thought my speech was so slurred, I couldn't get anything out, and I thought, oh, I'm going to die today. So I ended up telling him, I remember thinking, tell him how much you love him, because you might not come home to him. And we were in the emergency room, and the doctor told us that it was in my head, that I needed to see a psychologist, that they couldn't help me. As I'm hunched over in a wheelchair, and my husband's begging them, saying, this is not my wife. This is not my wife. She's not making this up. It's not in her head.
The ability to diagnose long COVID is a concern for doctors at the Stanford Long COVID Clinic.
It's very important too is the physician to be sure they recognize that the patient has a problem, because most of the patients, they look very healthy.
They admit staffing is a struggle.
We worry about it because there's a lot of people, there are few of us.
At the Stanford Clinic, as 300 patients are waiting to be seen, the next available appointment is in October. At Kaiser, they don't have a long COVID clinic or long COVID specialist. Their doctor told us their existing team knows best.
We don't have a long-term COVID clinic, but I think what we have is more powerful, which is basically a multidisciplinary team approach, which starts with your primary care doctor, but then there are specialists, therapists, mental health, whatever else is needed. We know a lot more now. A year ago, probably not, but we do know a lot more now.
KCRA 3 Investigates also reached out to Dignity Health and Sutter Health. Neither of them have long COVID clinics or doctors specializing in long COVID. Rodriguez was so frustrated with the lack of care at Sutter, she eventually traveled to Mexico, paying $20,000 for stem cell treatment that's approved in the U.S., but comes at a higher cost.
We found out after we had the stem cells done that the cost of what we had done in Mexico was at least almost $250,000 to have them done here versus having them done in Mexico.
3 months later, she can finally walk on her own.
All of the 36 symptoms that I had over the course of the 3 months started to go away.
I hated this thing so much.
Nobody in the United States was willing to help me. Nobody was saying, try this, try this. It was, you're fine, it's in your head. So we had to take it upon ourselves to go there.
Brown says she's also learned to become her own advocate and do her own research.
This takes up energy to see all of these people. It takes energy to fight back, really, and advocate for myself. I've been trying to get transferred to Stanford for 5 months now.
We are deeply concerned about the level of care that we've been able to receive. It was an illness that Chelsea was never able to get out of, and we were never given any answers as to how to get out of it.
You know, I still don't know. Will I ever be able to run again? I don't know. I don't know, but you find new ways of joy, right? We were able to take the boys to the beach, and I just sat there, and I was content with just sitting there and watching them play. I was okay with not running in the water and trying to surf or boogie board like I would used to, but just, you know, slowing life down. So I think it's just a waiting game. Hopefully crawl out of it on my own. If not, somebody comes up with something a year or 2 from now that will help.
Can you believe that?
I've got to.
After our interview, Chelsea Brown learned she was rejected by the Stanford Long COVID Clinic because she never took a PCR test from a medical provider to prove she had COVID. Like many, she used a rapid test at home. And we also do want to mention tonight that Brown was vaccinated against COVID and Rodriguez was not. The CDC says unvaccinated people are more likely to get long COVID.
So important for people to get that PCR test. And, you know, I have people in my own family with long COVID, and in those cases, the original case wasn't even that bad. It seemed like a very mild case of COVID, and yet these long-term symptoms. So for people who do have long COVID in this area, I'm sure there's people wondering right now, are there clinics that don't have a long wait list?
There are. One of those clinics is actually UC Davis. So at last check, the wait was about a week, and you can also be seen there and referred by another provider there as well. And we do want to point out again, patients do need a PCR test if they do want to get into the healthcare system there at UC Davis to be seen for long COVID, because again, those rapid tests, people are not taking those.
Yeah, I mean, it doesn't get it on the record. You can see it in your kitchen, but it's not on your medical record that it's a diagnosed case.
On that record.
Right. Okay, Brittany, thank you.
Just some really good sensitive storytelling there, Brittany. Thanks.
Thank you.
Well, we want to hear from you. If you've experienced anything like this long COVID that we've been talking about, these symptoms, scan the QR code there with your cell phone camera, and you can tell us your story. Lots of viewers are already reaching out. We would like to see your comments as well if you want to share them.